Welcome to this week's Resoluna podcast. We are very fortunate this week to have Dr. Chanu Dasari of the MGI Clinic to talk to us about gut health. So Dr. Dasari, welcome to our podcast.
Yeah, thanks for having me.
Well, thanks for coming. If we can start off with just a little bit of your background so our audience can know who you are.
Yeah, so I'm based in Vegas. I'm a gut surgeon. I have a coaching program for people with autoimmune disease because I myself had I had 4 different autoimmune diseases when I was just 19. And this coaching program is allowing people to rebuild their gut microbiome so that they have a lot less inflammation and can ditch their medications totally. We've seen people recover in as little as 2 weeks on this program, and so it's something that's very special. I run it myself, and people, I would tell you, are really getting benefit out of it, and they're able to ditch their medications, ditch their doctors, and really find a good alternative.
So I know it's the mind and the gut, and you did surgery. How did you switch from surgery to realizing the mind is affecting the gut to even want to create the program?
I still do surgery, so I still have a surgical practice. I got my start in Crohn's disease and ulcerative colitis, and these are typically surgical conditions, right? People come to my office after they failed steroids or biologics, and they need parts of their intestines cut out, which is crazy to even think, like, hey, an autoimmune disease ends up with you having an organ removed, right? So I was seeing these people in my office, and little did they know I had the same disease 20 years ago. And so we're having these conversations. I said, have you tried this? Have you tried this? Have you tried this? And these are all things that like rebuild the microbiome. And their gastroenterologist basically didn't talk about any of these things. Their doctor just blamed genetics. They just said, hey, you're gonna have this forever. Here's the steroid, here's the infusion. You're stuck at that point. And then they're in my office, obviously, because none of that worked. And now they're wanting surgery. So that's kind of how I got my start was, it was something that I'd fixed in myself many years ago. I didn't think much of it. And then I started getting these clients in my clinic for surgery. And I was thinking, wow, like these guys are doing something way extreme to try to fix their problem. And I was getting them well. And these are people that have failed conventional therapy and they were avoiding surgery. And so that was the birth of the MindGut Immunity Clinic. And in the past 3 years, I took this clinic online. So we have this really large, robust YouTube following. And in that, I get clients from around the world. Like we have clients in every time zone right now that we help get off of their biologics and their mesalamine and their steroids. And we've since expanded the program to include other types of autoimmune diseases. And so we have a lot of lupus patients, rheumatoid arthritis, psoriasis, eczema, chronic pain, ankylosing spondylitis, IBS. There's a lot of autoimmune disease on this earth. And so it all starts in the microbiome.
Okay, and in transparency, we work together. So I do see some of your patients in my coaching practice. And we know that the mind has a lot to do with the gut biome, right? So what have you seen consistently in your patients, like as far as their mentality that you feel is contributing to the gut situation?
100% of people with autoimmune disease have major trauma in their life. And when I'm talking about trauma, I'm not talking about like they got abused necessarily or something bad like overtly happened to them. What I'm talking about is this idea that they ignore their needs for a sustained period of time. We're not talking about days here. We're not even talking about weeks. We're talking about months, years, decades of people just ignoring their needs, putting other people's obligations or society's expectations ahead of their own needs. And this happens on a very consistent basis, and I would tell you 100% of the people with autoimmune disease have this problem. They have a lack of awareness of their own needs. They have a lack of awareness for their own trauma, and that's really where you come in to try to build that awareness. I mean, you're not gonna, we don't fix their trauma in a month, right? But what we do bring is an awareness, and that awareness allows people to really, put some mental energy towards fixing those items.
Yeah, I mean, from my experience with your patients, even the slight awareness of themselves, like they don't even realize they're doing it some of the time, right? And then they don't realize that their condition is partly and due to some of their thinking. So I know when you're coaching them, how do you handle the pushback of, no, I'm fine, I don't have trauma, there's nothing going on in my life, this is just physical?
Yeah, so we do have a lot of clients where they just, there's this sort of, I would say, they've ignored their needs for so long that there's this resistance, I would tell you, a resistance towards, I have trauma in my life. And I would say it's more men that feel this way than women. I'm not here to be sexist, but like this idea of ignoring your needs and not being aware of it, it tends to be a male phenomenon more so than female. Although female do it in a different way, right?
Well, yeah, they're the people pleasers, they're the over nurturers, they're the ones that are forgetting to eat instead, because they have something else to do.
Right, it's a different pattern, but like, so yeah, but the ones that are like really close-minded to this idea of trauma, they're the ones that probably have the most trauma, and the way they got over it is by shutting it out and
Right.
like really not paying attention to it for many, many years. And I would tell you, I am in that same boat, right? I am in that boat. You were my awareness coach many years ago. And so this is something that even at the highest levels, like the CEOs, the doctors, the lawyers, the entrepreneurs, everybody has this problem potentially that they can fix and pay attention to and really expand their worldview, I would say.
Well, and because I know you, I can honestly say, like, you've done a lot of work on yourself. So it's not like you don't have to do the work. What are some of the steps that you took in the beginning to overcome small t trauma or whatever it was that led you where you were?
Yeah, small t trauma is interesting, right? It's not this idea that you got abused or someone hit you or there was some overt event. It's just this slow, progressive ignoring of your own needs. And when I became aware of this was I read a book by Gabor Mate called The Myth of Normal. And he has a lot of books, by the way, like Scattered Minds is a great book. Why We Are Sick, right?
He's on YouTube. He's got information.
Yeah,
out there.
highly recommend if this is something you even want to start an exploration in, definitely check out Gabor Mate. But in his book, The Myth of Normal, he has an entire chapter dedicated towards people with multiple sclerosis and autoimmune disease. And he was the first one to notice that 100% of these people have trauma in their lives. And the one question that I would tell you is the most important thing for people that ignore or that have trauma and are unaware of it is, do you ignore your needs on a consistent basis, and why? 100% of people won't answer that question right away, but they'll think about it, right? And they'll answer it in a way that says, well, yes, I could, maybe use some more rest in my life. Or I could use more time spent in nature. Or I could use more intimacy. I could use more artistic expression. Mm-hmm. So whether that's listening to music or painting or whatever. I would tell you, if you surveyed the audience right now and about those unmet needs, those 4 or 5 unmet needs I just listed out, I would tell you 100% of people watching this podcast will tell you that they have an unmet need in one of those 4 categories.
And those are basic needs, right? We're not talking about extravagant needs. We're talking about basic needs.
And then you ask the next question, which is, why are you ignoring those needs? And the why you're ignoring those needs come down to, well, I have this obligation, or I'm using my time to do this. And it's obvious there's always some reason as to why they're ignoring their needs. So then you get to the next question, which is, okay, what can you do to restructure your life around having more balance? And there you're not addressing the trauma, but you're pointing out the trauma is happening, that it's playing a huge role in people's decisions, how they function day to day. And once you have a conceptualization of how trauma is operating in your life, then you can create awareness of where that came from, and sometimes you never know where that came from. Sometimes it's just like a societal or cultural or parenting sort of thing. And but it does create that fundamental shift in the awareness, which allows people to fix that problem long term.
So thank you for that. That was a good explanation. When you're talking, I'm also thinking about, you say trauma. Do you feel like conditioning is trauma or can be trauma?
If the conditioning causes people to ignore their needs and place other obligations in front of it, then yes. Conditioning, in that category of conditioning, I would say parenting. I would say cultural expectations, like I'm Indian, like we have a fairly traumatic culture, but we're not the only ones,
Right.
right? You know, in the American culture, I guess you could say, there's this culture of success, of materialism, you know, of trying to be in this rat race of, you know, always like, you know, trying really hard and being workaholics. So there are even cultural issues, even in like Western culture
Sure.
too, right? And these sort of ideals have been so normalized that we don't even sit there and think, am I ignoring a part of myself in order to fit this conditioning? Because you don't even know when you're being conditioned, right? Like it's just something that happens when it's like when you're a kid or when you're a baby, or even before you were born, right? It's
Yeah.
just, there's all these risks, all these factors that go into it. So you know, I would tell you, yeah, conditioning is where most trauma happens.
And
And
I
then,
think people
yeah,
underestimate that, right? They don't look at that as trauma. They just think, oh, that was my childhood. But it's certainly shaped where they sold themselves out in places in their life. Would you agree with that?
yeah, and the selling out, they don't even know when it's happening. Like they have no idea when that sellout happened. They might be able, like if you get a rare individual that you work with that is hyper aware, they'll tell you, hey, it was just this one day on this day that something clicked and I started ignoring myself. They'll tell you that.
Right.
And we have clients like that just say it just like that. You know, they're aware of how they're depersonalizing themselves. But I would tell you, most people, it's more of like this insidious, like, you know, like low lying, like you don't really know where it came from. You have some ideas, you have some theories, and you'll never, and some people never even know where it came from. I don't even think the where it came from matters, to be honest with you. It's just how it affects your life
Now and where you're
now.
going, right?
Yeah.
So some of that could sound to some people on the woo-woo side. So on the medical side, do you feel from a scientific perspective that their gut is being affected in some way that we can demonstrate?
Yeah, so if you look at this from a very objective standpoint, let's just look at people that ignore their needs. Let's not even talk about the trauma for a second. Let's talk about people that don't get enough sleep. We know that lack of sleep leads to higher cortisol levels, which leads to microbiome disturbance in chronic inflammation. That's a known fact, okay? We know that stress can increase cortisol levels as well. We know that other types of self-care behaviors can also fix the microbiome. For example, meal prepping, having a balanced diet, not making these rash decisions based out of comfort. Like a lot of people will comfort eat, or they'll eat because they're around some friends and so that's what they're serving, or they're at work and they've got like, you know, pizza or cake there, and you know, which always happens at the hospitals, by the way. The
For
hospitals,
sure.
you want to talk about the least healthy place, it's the hospitals, okay? Like everybody there is stuffing their faces, the doctors, the nurses, the orderlies, everybody.
I was guilty. A farm rep, we bring donuts every week, like,
Right, you bring donuts to doctors'
we
offices,
totally.
right? So I guess what I'm saying is that self-care and that awareness of one's own needs, it carries over to every aspect in your life, the relationships, your relationship with food, how well you're planning out your day so that you get all your needs met. And so it's this compounding effect of, you know, I've ignored my needs and I'm going to continue to do so despite being sick. And so from an objective clinical standpoint, if you're trying to fix something that is wrong with the body and your mind is occupied in some different direction, it's not in alignment, it tends to be a problem. And I would tell you, these are where you get the worst outcomes, right? And I'm not just talking about autoimmune disease. We have people with heart disease, premature heart disease. We're talking cancer, right? And all of these are elevated and worsened in places that have a workaholic type culture and have a very traumatic sort of culture around it. And I would tell you that that is not an accident. That's been proven scientifically.
You know what I tell your patients in particular, like even if you don't buy in that your mind has something to do with this, if your mind isn't healthy, fed, and safe, it's not going to help your condition. So we have to address it, whether you feel like your thoughts are affecting your body or not. It
Yeah.
can only help to heal your mind and create the right environment.
Yeah, and I'll tell you, we have clients that we never get past the very superficial discussion about trauma, and they still get better, okay? They still get better despite the lack of awareness surrounding this issue. So I'm not saying it has to happen, but I'll tell you, it's much easier to get folks to the finish line when they realize that there's something about their own operating system that they need to upgrade in order to be better people, or to be better stewardesses of their own health. And once that realization happens, even if you don't fix the trauma, at least you create some awareness of what people are doing on a day-to-day basis, and then they can move forward.
So changing their diet helps. What are your main goals when you start with your clients as far as like tactical, logistical diet changes?
Yeah, I'll just say the 5 main issues that everybody has that has autoimmune disease or chronic inflammation or any health problem for that matter is diet, digestion, sleep, stress, and exercise. These are like the big 5.
Okay.
And so out of that, I would tell you diet and digestion are probably 60% of the equation because that's where your microbiome lives. That's where all of the, all of the fuel in your body goes into. And then if you're eating foods that are, say, pro-inflammatory, that's what stimulates the inflammatory response. Because 80% of the immune system is in the gut. So the diet and digestion matters the most in that context. After that, I would tell you, yeah, we do put people on exercise programs. We do work with them to optimize sleep and stress and trauma. And people get better. Like, it's not like something that they have to wait months and months to get better. People are getting better within weeks. I mean, we've had clients better within
Yeah.
1 week.
Mm-hmm.
I mean, these were people that were on medication, about to get surgeries, this is like crazy stuff, and they're better in a week.
Yeah.
You know what I mean? And not taking any medicine. So, I mean, that's not always the case. I would tell you, like, for every one of those, we got ones that take like a few months, right? And so, but the whole point of this is just to tell you, if you reorient your entire like your day-to-day, everything that you do, all your activities, if you reorient it towards self-care, and it's in alignment with trying to fix the inflammatory risk factors like diet, digestion, sleep, stress, exercise, and you have a coaching program built around it, that's what people really want. And they want some expertise. They don't want some generic advice to like take this supplement or do this crazy diet. They want people that can actually recalibrate the microbiome.
So tell me about that 80% number again. Like what does that mean exactly? Because I don't even exactly know what that means.
So the intestines are like this giant tube. And around this tube, there's a lot of immune cells. Because if you could imagine, there's all this bacteria in the intestine and all this food getting digested and fermenting. And I don't know if you've ever seen food fermenting on like a kitchen table, but it's not the prettiest sight, right? It's like
the decay of it.
Yeah, it's like decaying in your
Yeah,
body, okay?
yeah.
So that's what's happening, right? It's happening in all of our bodies. The rate of decay, the extent of the decay, the type of decay is different in everyone because it's based on what type of bacteria you have. It's based on what type of food that you ate. It's based on how long it's been there, right? These are all factors that create inflammation in the body. You can fix every single one of these factors, and you can use precision calibration to dictate what types of bacteria are fermenting what types of food and at what times. And so we're really in the weeds on that. Like we ask for stool photos, we ask for food logs, we track everything every single day. And we're
Okay.
looking at them in real time and making adjustments every single day. And so when you fix that sort of problem, what you see is that surrounding these tubes are these immune cells. And the reason the body puts all their immune cells around this intestine is because that's where all the stuff is getting fermented. That's where all the bacteria is. That's where everything that's being introduced in the body is going. That's where 80% of the immune system is. It's called mucosa-associated lymphatic tissue, MALT for short.
Oh,
That's where 80% of the immune system is. So of that 80%, right, you're thinking, okay, well, if I have an autoimmune disease, where should I place all of my emphasis? Should I place it on the hair or the skin, or I'll even tell you, even like eczema and psoriasis, we used to think of them as skin problems. They're not skin problems, they're gut microbiome problems. Multiple sclerosis, something that affects the brain, starts in the gut. These are all things that are dictated by what the immune reaction is that's occurring in the gut in response to fermentation end products and different types of bad bacteria. And that's generally where we spend most of our time in the program.
Okay. And so the mind, is there any chemical reaction there that relates to the gut? Or how do the thoughts and the mind and I guess the stress, if you're thinking stressful, then you're releasing?
It actually works both ways.
Okay.
So the gut is the #1 producer of stress hormones. And the fight or flight starts with what you're eating. And it goes both ways, right? You eat something that creates a lot of like neurotransmitters like serotonin, and you have like there's all these neurotransmitters that the gut produces. It's the #1 producer of neurotransmitters in the body. And so what you eat is affecting how you think, and how you think is sort of affecting how you digest. And so there's this two-way crosstalk. There's even bacteria in your gut that affects your mood. They send text messages to your brain to be depressed or happy or hungry or sad or, whatever it is, obsessed.
Yeah.
I mean, these are all valid. I mean, by the way, there's a study to back up every single one of these things, right? There's happy bacteria. There's fat bacteria.
Wow.
There's skinny bacteria. There's depressed bacteria. There's schizophrenic bacteria. There's autistic bacteria.
That's crazy.
I know.
That's a lot.
And to think like the bacteria in your gut is what it's sometimes telling your brain what to think is mind-blowing.
What's mind-blowing is how casually we eat. With you saying that, or even someone saying, I didn't have time to eat.
Right.
Like, this is your vehicle. Like, don't you need your vehicle to get through life, right? But
yeah, it's like saying, oh, like I didn't, what did you do today? Well, I went to a random crowd of people and started talking to people. It's like, no, you should have been spending your whole day with family, with friends that you like, right? So if you just spend all of your time randomly with all these people indiscriminately, what are you going to get? You're going to get this totally disheveled and broken relationship system, right?
mm-hmm.
And that's sort of what our relationship has been with food. I would tell you, like 90% of people don't really think about what's going in their system. It's just sort of on autopilot. And so once you start being more precise and more deliberate about your food choices, and I would even argue your relationship choices, right?
Yeah.
Your life tends to improve substantially in a short period of time.
So interesting, you used the word choice twice, right? And I think just from being an awareness coach, people put themselves in a position where they feel like they have no choice. But we have a choice, always.
Yeah, and I'll even tell you, there's some people that fail to use their choice. So there's some people that think there's no choice. That would be one group of folks. There's another group of folks that they don't even think to exercise their use of choice. And these people fall into that category of people that think, hey, everything's okay. This is the way things will be. They don't have that added awareness of, hey, I could make a choice to do something differently and get a different outcome. That's not there.
Yeah, and there's another option, right? I'm choosing to do this, so then I'm going to do it happily because I'm making that choice. I'm not being forced to do the choice.
Right.
I'm bringing that up just because every patient I talk to that you have that is at the level where they're so sick they do need you, it comes down to these things.
It does. Yeah, it's really basic things. Really basic things. It's basic things that I would tell you toddlers understand, but we as adults somehow forgot.
Right. And mentioning toddlers, so you've counseled all of these people, now you have a toddler.
Yeah, I have
right?
a toddler.
And so
yeah.
how has it affected your parenting, realizing that our minds really affect our lives, our choices, our body, our gut biome? What shifts have you?
Yeah, babies and toddlers are really good at expressing their needs. They're really good at not ignoring their needs, right? When they're hungry, they cry, and then they go eat. When they're sad, they cry, right? And they walk away from whatever is causing their sadness. When they're happy, they don't worry about what time it is, or they just play, and they don't even think about what they have to do, right? And so every step of that existence in infancy and in toddlerhood is around kids being totally in touch with their own needs, and it being an automatic, I would argue, God-given gift to babies and toddlers.
Yeah.
And through the process of growing up, and some would say parenting, through that process, there's different needs that become, I guess, ignored, right? So if a parent says, hey, don't cry, then that baby is going to say, oh, well, I wanted that one thing, and I expressed my displeasure, and my parent said, don't cry. Well, maybe the next time I won't express my displeasure when I'm sad.
Mm-hmm.
So then you get people that grow up to be people pleasers, right?
Right.
You have all these, you're interacting with all these people making you angry, and instead of just saying, hey, get out of my life,
right.
You're putting up with these people. Or, there's different contexts, but,
sure.
I think you understand what I'm saying here. So I think the only thing parents can do in a situation like this is to be hyper aware of their own interactions. And because I fundamentally believe the only thing parents can do is really screw up this process of development. There's not a whole lot of like, it's not like I taught my child to be aware of their needs. I didn't teach her that.
Right.
She taught me that. It's the other way around, right?
Yeah.
She taught me that. And so, parenting is just this interesting experience, I'll tell you. It's a very interesting, I'll just leave it at that.
Okay. Well, and it sounds like as a parent, if you're just housing the needs and trying to support that in the child, they're going to let you know.
Yeah, and if you listen, right? If you're so my big problem was, if you have a parent that's ignoring the child, I guarantee 110% of the time they are also ignoring their own needs.
Exactly.
Right?
So it's not on purpose, is what you're saying.
I think that when I first called you, the reason this whole idea came to my mind was my baby was crying, and my response was, man, I wish you'd just stop crying. I'm going to try to ignore it. And then a light bulb went off in my mind, like, oh my God, I have a baby crying. She's my baby. I'm trying to ignore it, right? What if I'm trying to ignore a baby's needs? Am I ignoring my own needs in my own life? And that's when this whole deep discussion and exploration happened in my life. And this was years after I'd fixed my own autoimmune disease. That's when I called you, because I was like, I'm calling Virginia because she's the one that deals with this stuff. And that's when this exploration started. And then, I realized that I'm not ignoring my child's needs. I ignore 90% of my own needs on a daily basis. And it's a problem.
Yeah.
It's not okay. That's a problem,
Well, what I learned from all of that was like parents are going to be parents, kids are going to grow up. But when we're at a certain age, we get to self-develop and look at, okay, who am I now? And where do I want to go? And I feel like that's what you did on your journey. You took it in your own hands and you became responsible for yourself and your thoughts.
Yeah, you can't blame anyone else. Who am I going to blame? I'm going to blame, my parents or like the culture that I grew up in? Like, you can't blame other people for your problems. At some point, you have to take personal responsibility for everything going on in your life, even the stuff that you want to blame someone else for. You have to take some accountability to try to fix those problems. Otherwise, you get just stuck. You get stuck and you feel like you have no choice, but that's never the case, really.
And to quote Dr. Gabor Mate, he says, like, if you get triggered by someone else, you're holding the gun. They could not trigger you if you didn't have the gun inside of you. And whether that's people pleasing, perfectionism, it doesn't matter. They're the trigger, but you're holding the gun.
Yeah.
Yeah.
Absolutely true.
All right. So if you had 5 tips to give in total to people struggling with any one of those disorders, autoimmune, people pleasing, whatever, what 5 tips would you give them?
Tip number 1, plan your day. Seems very basic, but I mean really plan your day around self-need. These would include naps. These would include sleeping on time. These would include your meals. I'm not even saying what to eat at this point. That'll be number 2, which is plan your meals, right? Plan what you're eating. These things are very, very crucial because if you don't make a plan, you will end up in this random situation. You'll end up in a lot of random situations, unplanned eating situations where you'll reach for this snack or you'll eat this because you're in a hurry and you're really hungry. When you need you need enough protein, you need healthy fats, you need healthy resistant starches, you need phytonutrients. And so if you haven't planned your meals out, I would say that's number 2. Number 3 is exercise. Lift some weights, do some resistance training. If you're injured, go for a swim. Some basic level of movement and building muscle is a huge, huge part of any type of, every organism moves. And so it's a huge part of human health. Number 4, I would tell you, if you are struggling with some type of health issue and you're not getting very far with your doctor, I would do some exploration and find ones that listen, find ones that you can work with on a regular basis, because the worst thing that can happen to someone is when they're sick, their doctor ignores their own needs as well. And I'll tell you, coming from the medical profession, that's the rule. That's not even the exception to the rule. How many times have you walked into an office and within 15 minutes you're in and out, and then you see the doctor later on, who knows when you see him, and they haven't fixed any of your problems, by the way. They just write you for a test or a prescription and you're out the door, right? Number 5, and this one is a very important one. Everyone should go through this process of trauma awareness, and you don't have to do it formally with some type of counselor. Some people also call this shadow work. It's also called inner child development. But this idea that you can get reconnected to your own needs and understand how that reconnection can play into your overall well-being, I think is a very important process that everyone needs to go through. And I will tell you, once you go through that process, it's not a one and done over kind of thing. It's a lifelong situation. But as you go through that process, you will find that a lot of opportunities will come your way. Your worldview will expand, and everything around you will start to sink, and you'll find a lot of success in your relationships, in your work, in your health. And I think that taken as a whole, those 5 suggestions are something that I live and breathe by it now.
I can attest to that since I know you very well. And if I could add to that and see if you agree with that, part of that process doesn't have to be finding blame, who did what. It's really could be a fun rediscovery of self. And it's not that you're just uncovering who you are and remembering who you are. It's not that you're trying to be someone else or blame the parent, or because really it's really about just uncovering what's already inside of you. Mm-hmm. And it can be a fun process. It doesn't have to be a daunting process where we need to talk about everything that happened in your childhood. It's more getting back to know the child inside of you.
Yeah, and relating to what life was like as a baby, infant, or a toddler, right? I don't think we were worried about bills. I don't think we were worried about finances. I don't think we were worried about people that were mean to us. I don't think we were worried about, where the next meal was or what we were eating. I think there was a lot of things that we have forgotten in our own self in this process of growing up. And it's something that, results in a lot of suffering, I would tell you. And there's no blame to go around, because really, if you don't fix these problems yourself, you're still going to have the problems. So who's to blame at that point, right?
Well, yeah, and I'm sure I know I've seen the perfect parents. They've done everything right. They sent them to school. They love them. And the person still has something, because it's your own mind you're caring for. Once you're out of the house and you're old enough, it's your own thoughts. So either way, you're responsible.
You're responsible.
Yeah. So if you can indulge us here on the Resoluna podcast, we like to pick a card at the end of every session. So if you want to shuffle these a little, and these are surrender cards. So your card will be the card for the audience. And then if it resonates for you, if that's the one you want to do, let's read it.
Surrender resentments. That's a good one.
Perfect for what you were just talking about, right? Resentments. Like, what are you holding on to and you're resenting that didn't turn out the way you wanted to? Because you had maybe an expectation?
Oh, I'm that guy. I'm the guy that literally, I'll replay parts of my life and be like, man, that's why this happened, right? And I wish that were different, and so.
So you're holding resentment?
Well, remembering resentment, I should say. I wouldn't say holding, but this idea of letting it all go. Yeah, it's been a process.
All right. So surrender resentments.
Very appropriate card.
Awesome. So thanks for coming with us today. We really appreciate it. And hopefully everybody gained from this as well. So if this card meant something to you, take it. If it didn't, you can let it go.
Yeah.
Thanks.